Title: High-Yield Anatomy of the Eye for Exams. I'm keeping this fast and exam-focused. If you can sketch this map in your head, you'll crush most eye questions. Start with the coats of the eye, 3 layers. Fibrous layer, cornea, avascular, most of the eye's refractive power. Corneal layer, epithelium, Bowman's layer, stroma, Descemet's membrane, endothelium, pumps fluid out, failure leads to corneal edema. Sclera, tough collagen, extraocular muscles insert here. Vascular layer, the UVAA, iris, sphincter pupillae, parasympathetic, causes miosis. Dilator pupillae, sympathetic, causes mydriasis. Ciliary body, ciliary processes make aqueous humor. Ciliary muscle pulls on zonular fibers to accommodate the lens. Parasympathetic contraction rounds the lens for near vision. Choroid feeds the outer retina via posterior ciliary arteries. Inner layer, the retina, neurosensory retina. Retinal pigment epithelium, the RPE. Macula at the posterior pole. Fovea, center of macula. Cones only, a vascular pit, highest acuity. Optic disc, the blind spot. No photoreceptors. Arteries and veins visible. Chambers and fluids. Aqueous humor is made by the non-pigmented ciliary epithelium. Flows from the posterior chamber through the pupil into the anterior chamber. Drains via the trabecular meshwork to the canal of Schlemm, the conventional pathway, and via uveoscleral, the unconventional outflow. Block outflow leads to glaucoma, open angle, chronic outflow resistance. Angle closure, the angle is physically blocked, painful red eye. Mid-dilated pupil and angle closure. Lens, biconvex, avascular, held by zonules. Cataract, opacification of the lens. With age the lens is less elastic. Presbyopia, near blur. Vitreous, gel in the posterior segment. Vitreous traction can detach the retina. Symptom, flashes. Symptom, floaters. Symptom, a curtain or shadow over vision. Blood supply, inner retina via the central retinal artery. Outer retina via the choroid and posterior ciliary arteries. Central retinal artery occlusion. Sudden painless monocular vision loss. Fundus, in CRAAO, shows a cherry red spot at the macula. Venous drainage, central retinal vein. Vortex veins drain the choroid. Optic nerve and visual pathway. Ganglion cell axons form cranial nerve 2. Partial decussation at the optic chiasm. Nasal fibers cross. Optic nerve lesion leads to monocular vision loss. Chiasm lesion, bitemporal hemianopia, think pituitary. Optic tract lesion, contralateral homonymous hemianopia. Occipital lobe lesion, contralateral field loss, often with macular sparing. Pupillary light reflex pathway, retina to pretectal to bilateral Edinger-Westphal to CN3 to ciliary ganglion to sphincter. Afferent defect, optic nerve, gives a Marcus Gunn pupil. Sympathetic path descends to the superior cervical ganglion, then travels via long ciliary nerves. Lesion yields Horner syndrome, ptosis. Horner syndrome, meiosis. Horner syndrome, anhidrosis. Surface anatomy. Eyelids with tarsal plates. Meibomian glands, lipid layer of the tear film. Conjunctiva lines the lids and the sclera. Lacrimal gland makes the tears. Tears drain. Puncta, then canaliculi. Lacrimal sac. Nasolacrimal duct, to the inferior meatus. Extraocular muscles and innervation, LR6-SO4-AO3. Lateral rectus equals CN vax. Superior oblique equals CNIV. All other EOMs equal CN3. To isolate obliques, adduct. To isolate recti, abduct. That's your high-yield map.